Medical professionals and other relevant stakeholders gather at the Dala Orthopedic Hospital in Kano State under the auspices of the Association of Resident Doctors to tackle the worrisome trend of patients and their families attacking health workers with verbal abuse, physical assault, and in some cases, kidnapping of doctors. In attendance are policymakers, security agents, civil society organizations, traditional rulers, and other members of the public to ensure all hands are on deck to stop the trend where patients' families take the laws into their hands when they don't get the answers they want.
We have a growing incidence, especially here in Kano, where there is violence, against healthcare workers, and this is quite a very serious problem. This is something that is unacceptable and should not be tolerated. The reason is that by the time you harass a health worker or you physically harass a health worker, the care he's going to give subsequently, not only to that patient, but even other patients that are coming to hospital will be affected. And unfortunately, this thing is escalating in so many other areas, and we felt there is need to carry out this type of workshop, this type of gathering, so that these issues can be discussed.
The government says it will do everything that needs to be done to give justice to those caught in such incidents and also provide enough security for hospitals across Kano.
Excellency gave us approval to employ 250 security men to work in our facilities. We have already employed them. We have already deployed them to all our facilities. They are going to receive a formal training by security personnel in the state. So Kano State government is doing a lot in preventing some of these violences.
President of Resident Doctors Association, National Orthopedic Hospital, Dala, is hopeful that the conference will help stop violence against health workers in Kano.
Distinguished panelists we actually have panelists covering every aspect. We have panelists from the legal side who has actually taught us about the legal implication, the right of a doctor. One of the critical points he mentioned, a doctor actually has a right to refuse to attend to a patient. So as against the popular belief that when you come to a hospital, you have to be attended to or you have to be seen. We've also looked at some of the causes that trigger some of these violences, as has been identified by the NGO representatives as well as the security agencies.
After identifying some causes to be inadequate security, lack of awareness, societal attitudes, and even stress from patients and their families, panelists believe that steering the conversation in the right direction will eradicate violence against healthcare professionals, and this will improve the quality of healthcare. From Kano Commercial City, Nanchin Vincent, Channels Television News.